Today we will be doing pediatric dosage calculations. So let's jump into our first problem. So the problem says a child is ordered 0.2 grams of a medication IV piggyback every 4 hours. The child weighs 31 kgs. The recommended dosage of this medication is 15 to 60 mgs per kg 24 hours. So the first question is, how many mgs is the child receiving each day? So we know that our answer needs to be in mgs. So we're going to start with what's ordered. So it says that 0.2 grams is ordered for that child. And how often does that child get that medication? So that child gets that medication 6 times a day. So we want to keep that in mind. So, but our answer needs to be in milligrams. So we're going to convert grams to milligrams. So we know that 1 gram is 1,000 mgs. All right. So after you cancel out your grams, you then be left with 200 mgs. But you're not done yet. So remember, we said that this patient gets this every 4 hours. So we know that this patient will get this 6 times a day. So the dose that this patient will get per day is 1,200 milligrams. All right, so the next problem says, what is the low recommended dose for this child per day? So we want to go back to the problem to see what is the lowest dose. So the lowest dose that the child can receive per day is 15 mgs per kg a day. So we want to start with that. So we're going to write 15 mgs per kg a day. So our answer needs to be in mgs per day. So that's simple. All we got to do is cancel out our kg. So we're going to use the child weight. So in this problem, the weight is already in kgs. If it was not in kgs, you would have to convert. All right. So the child weighs child weighs 31 kgs. So just put that over 1, and we're just going to cancel out kgs, and then you're left with milligrams per day. So multiply straight across, then divide, then you'll get 465 mgs per day. So this is the minimum amount that the child should be receiving. This is the minimum recommended dose. All right, so the next part says, what is the high recommended dose? So we go back to the problem, and it says that the highest that the child should be receiving is 60 mgs per kg a day. So 60 mgs, and then we'll put kg day at the bottom, and we'll do it the same way we did it above. We are just going to take the child's weight of 31 kg and multiply it. So kgs cancel out, and we're left with mgs per day. So that child, you multiply that straight across and then divide, you're going to get 1860 mgs per day. So this is the range for the child. So the range for the child is 465 mgs per day. That's the minimum, and the maximum dose that they can have is 1,860 mgs per day. So the next question says, is the order safe and therapeutic? So this is our therapeutic range right here. And this is the dose right here that is ordered, which is the 1,200, right? So is 1,200 in the middle of 465 and 1860? Yes. So this is a safe dose for this child. All right, so the next pediatric question we'll be doing is, a child is ordered 575 mgs of a medication IV piggyback TID. The child weighs 25 kgs. The recommended dose of this medication is 20 to 50 mgs per kg every 24 hours. So the first question is, how many mgs is the child receiving a day? So first we're going to start off with what is ordered. So what is ordered is 575 mgs. All right, so we need to know how often is it ordered. So it's ordered every TID. So TID means what? Every 8 hours. So that's 3 times a day. So all we got to do is take our order and multiply it by 3 times a day, and you're going to get 17 25 mgs. So this is what the child is currently getting. All right. So the next question is, what is the low recommended dose for this child per day? So we're going to go back to our problem, and our problem says that the range is from 20 to 50. So our lowest is going to be 20 mgs per kg 24 hours. So we're going to go ahead and write that. So 20 mgs per kg a day. So we know that our answer needs to be in mgs per day. So we need to cancel our kg. So all we got to do is take the patient's weight. They already gave it to us in kilograms, which is 25 kgs. So kgs then cancel out, and we're left with mgs per day. So we're going to multiply straight across, and we're going to get 500 mgs. All right. So the next question says, what is the high recommended dose for this child? So the highest is 50. So we're going to do 50 mgs per kg a day. And we're going to do it just like we did that one. We're going to take the child's weight of 25 kgs, and we're going to multiply that. Our kgs cancel out, and then we should get 1250 mgs. So this is the range that the patient should be in. This is the safe range. This is the therapeutic range, 500 mgs to 1250 mgs. So let's go back to the first part. So the next question says, is this medication order safe? So on our first question, we got that the patient was receiving 1725 mgs. So does 1725 fit into this range of 500 to 1250? No, it doesn't. So the answer is no. This dose is unsafe. All right, so the next pediatric question says, the recommended dose of the antibiotic is 100 to 200 mgs per kg 24 hours divided in 6 hours, IV per syringe. An infant weighs 2,200 grams. So first we need to convert what the child's weight is. So we know that our weight needs to be in kilograms, and our weight is currently in grams. So we're going to take our 2,200 grams and put it over 1. So we know that there is 1,000 grams in 1 kg. All right. So our child's new weight in kilograms is 2.2 kgs. All right. So the next question says, what is the low recommended dose for this child per day? All right, so we go back to our problem. It says that 100 mgs per kg a day. So we're going to take the child's weight of 2.2 kgs, and all we're going to do is just multiply it straight across. And the child's low dose, recommended dose, would be 220 mgs. All right, so now let's do the child's highest dose that they can receive. So we go back to the problem, and it says 200 mgs. So 200 mgs per kg a day. We're going to multiply it by the child's weight of 2.2 kgs. So we're just going to multiply 200 times 2.2, and we're going to get 440 mgs per day. All right, so now we have our range. So our range is going to be 220 mgs to 440 mgs a day. So now we need to calculate what is the ordered dose for this child. Okay, don't pause it. I'm gonna keep going because that ain't the question. This one switched up. I don't think I got room. So you got pause. What is the low recommended single dose for this child? So we know that this patient is getting this medication every 6 hours. So what are we going to do? So we're going to take the low recommended dose, which is 220 mgs, and all we're going to do is divide it by 6. No, we're going to divide by 4. You're wrong. Back me up. Take notes, pause me. So the next part of the question says, what is the low recommended single dose for this child? So we're going to go back to the problem, and we're going to see that the child is getting this medication every 6 hours. So within the 24 hours, they're going to receive this medication 4 times. So what we're going to do, we're going to take our low recommended dose, which is 220 mgs, and we're going to just divide it by 4. This will give us the single dose. So in a single dose, the patient can have 55 mgs. And we will do the same for the maximum dose. We would take the 440 mgs and we would divide that by 4, and we would get 110 mgs. So this is our range when it comes to the single dose, as in this is our range when it comes for the entire day.